Hi, my name is Akira Kopec. I am from the Center for Civic Engagement, and I'm here with District 52's incumbent State Senator Lea Webb. Thank you so much for being here, and let's get started. So to
Okay.
begin, can you tell us why are you running for State Senate? And if you are elected again, what will be your top priorities for the district?
The reason why I am running for Senate goes back to well before being in my current role, and that is I have committed my life to public service. I really believe that our communities uh, can and deserve better. And unfortunately, what continued to happen is that policymakers we're making and continue to make policies devoid of the voices of those who are most impacted, especially marginalized communities. And so, as someone who has, been doing public service, community organizing, I started that off when I was 15. I didn't know it was community organizing, let alone I didn't learn until later you actually get paid to do it when I was after I graduated from college. But uh, this community, our state has a lot of great resources. And so I want to make sure that everyone has equitable access to those resources so that we all can thrive. And that's what motivates me every single day in the work that I do currently as our senator for our community, but even during my time at Binghamton University as an educator. Uh, I've worked with CCE for years when I was there. And even before that on Binghamton City Council, again, I really believe in the community that we have here in the Southern Tier and just want to ensure that our region gets our fair share and that everyone, as I said, can have a better quality of life.
Thank you for that answer, and thank you for the work you've done so far.
My
The
pleasure.
next question has to do with housing. As you are aware, affordable housing options in Binghamton are both slim for students and also families. How will you work to ensure that, especially with the new zoning laws that were recently put in place, that legislation is geared towards helping not only families, but also college students find affordable and safe housing options?
Yes, this is a top priority of mine for a number of reasons. One, housing is a fundamental need. We're all human, so we have to have a place to live. And going deeper into that, having access to quality, affordable housing is very integral in that in our what I call like our housing system. Whether you are an individual who is unhoused, you are a renter, you are an aspiring homeowner, you are a current homeowner, all the ways in which we access our housing system. And so in the state, I've been actively pushing for, and have been successful in pushing for more resources for the different levels of access in our housing system. So, for instance, there are several projects happening right now in our area to provide what's called wraparound or supportive services for individuals who are unhoused, who may be struggling with mental health challenges, substance use disorder. There are housing developments that are actually happening right now uh, to provide not only housing but wraparound services. So, continuing to support initiatives like that. Also, when it comes to resources for tenants, making sure that uh, tenants have access to quality, affordable housing. There was a investment in the two. I'll lift up three investments in the budget as it pertains to supports for tenants. One is the one shot grant program that for those tenants who have fallen on hard times and they have fallen back on their rent. This program has been in place, but this year we were able to expand it so that more communities like ours can actually qualify for those funds. There is another program that we had in the budget. It's called the New York Future Homes Project that allocated 75 million for renters and 75 million for homeowners to provide more supports for quality housing. Another piece that I'll lift up, and it transitions to homeowners, and that is similarly to the one-shot housing program, a housing assistance program. There's a program called the Home Ownership Protection Program, or HOP. This is a program that helps those homeowners who have fallen on hard times to be given additional supports to help them to stay in their homes. That's another provision. Also, in the budget, I'm very proud of this as well. I was able to get our area included in a $40 million pilot for a program called infill housing. Infill housing is an initiative that takes single family or two family homes and turns them into affordable housing opportunities. When it comes to development, because we know that there are various needs when it comes to housing, we continue to provide funding for programs like the Neighborhood Preservation Program and the Rural Preservation Program. These are dollars that go directly to developers that create affordable housing projects right here in our community and across the state. Uh, I think all of those resources, including others that I haven't mentioned, are very important. Most certainly, policies are important in that manner as well. We have to address not only the infrastructure, meaning updating and upgrading our current housing stock, because a lot of it is antiquated, but we also have to address the fact that a lot of families are struggling financially. And so, looking at ways to improve access to good paying jobs. So, a lot of the innovation that's being developed right here in the Southern Tier and the role that our higher ed institutions are playing, like Binghamton University, SUNY Broome, Cornell, many others within the Southern Tier that are doing the research or the R&D, research and development as it pertains to the green technology is really important. And so, where I'm pushing to make that connection is in workforce. So, working with our Department of Labor, making sure that people are getting training for these respective new careers, whether it's through working with our labor partners and the unions, other key stakeholders to make sure that people are really having a clear pathway towards, again, getting access to good paying jobs, but ultimately having careers that allow them to thrive. So, to me, housing, affordability, they all go hand in hand, most certainly. And so, I look forward to continuing to provide more supports for all those different ways that we access our housing system. And part of the challenge has been when we've made investments, when the state has made investments, and one budget doesn't solve it, to be clear. You have to make ongoing investments, but we also need continuous support from key stakeholders, whether it's our higher ed institutions, which are major economic development mechanisms for our communities, and most certainly other key stakeholders to help address some of these complex community challenges. I know that was a very long answer, but I just wanted to like tease out the different pieces too, because I think sometimes it just often gets put in a very linear manner, and it's not quite that. So, so yeah, those are my thoughts on
I
that.
appreciate your detailed answer. I think it's very true that all policy solutions are complex and it's not necessarily housing isn't just housing. So I appreciate you going into the different branches of that.
Sure.
The next thing that I want to ask about is healthcare.
Mhm.
You've previously introduced a bill that serves to help expand access to healthcare services for firefighters, as they are more likely to be diagnosed with cancer and cancer-related diseases. Your opponent's campaign website also indicates concerns over rising healthcare costs, and he also focuses on the expense of cancer treatment specifically. As you're aware, there are a multitude of disparities that exist when it comes to disease control and prevention. So I'm just wondering, what are your future plans in terms of addressing healthcare affordability and access for people specifically in District 42?
Yes, this continues to be a concern and focus of mine in Senate District 52, but across the board. I had got my start as an organizer and also specifically working on healthcare reform. We know that we need to make continued changes to our healthcare system so that we don't have families still having to file medical bankruptcy because of out of pocket costs. So, one of the things that we did in this legislative session, we became the first state in the country to actually cap the cost of insulin. We know in our area that chronic health issues continue to be very pervasive due to poverty, as an example. But we also know that the costs associated with conditions, whether it's diabetes or other health conditions, it's very expensive. So being able to save residents money when it comes to that is very important. There are other things that we've been doing. I most certainly have been supporting as the chair of women's issues in the Senate. We actually were able to get into the budget supports for the Reproductive Equity Fund. This is a program that helps to provide financial supports for individuals who are in need of reproductive care, which is also important. I think that overall, we continue to see, especially in our assisted living facilities, nursing homes, the different levels of care, the need for more supports. So we are actively working to expand those resources. So whether it's through our EMS providers or our first responders there, we have been pushing for ability and we've been able to do it so far, but we still have a lot of more work to do that helps them financially with the services that they provide, especially in rural areas where there aren't necessarily doctors available. So trying to find ways to get people, whether it's through transportation means, other means like telemedicine, to make sure people are getting access to, again, quality, affordable care. I'm also a co-sponsor on the New York Health Act, which this is a measure to expand even larger more quality, affordable healthcare options. So all of these aspects and more are what I've been working on and will continue to work on most certainly.
Thank you. You kind of talked about it a little bit in the answer to that question, but the next thing I want to ask is more specifically geared towards women's health and also
Mhm.
childcare access.
Yes.
So the passage of the maternal health package, served to advance and uphold progress of the reproductive rights movement. In a time of extreme uncertainty surrounding issues of reproductive health, what further steps will you take to ensure that women in New York have safe and equitable access to the healthcare they need? And then in addition to that, in terms of childcare and other related services, what steps can be taken to lessen the financial burden that families face?
So I'll start with childcare first, and then I'll go back to reproductive care. We know that childcare continues to be, it is a part of economic development. As we continue to expand opportunities for jobs, to ignore the glaring costs of childcare and the need for more availability when it comes to childcare is very important. So, one of the measures that we were able to get into the budget this year was to provide funding for the childcare block grant program. This is something, again, we have been supporting. I most certainly support, and that's providing resources to childcare providers. Another way that we're trying to make things more affordable, especially in the area of families and children, is continuing to support it's called the, oh my gosh, the earned income tax credit for children that allows the EITC, that allows for families to get tax deductions for families that have children, which is very most certainly important from a financial aspect. The other piece with that, it goes back to healthcare. We also put in a provision within the legislative session this year with regards to access to healthcare for children, that they don't have to have to go through the renewal process for health insurance, which is, it can be very uh, challenging for many families. So that's another area. I wanted to make sure I lifted that up from the previous question and tied it to this one. Going back to the top of your question, with regards to reproductive care. And the other piece I forgot to mention with childcare is a lot of the developments that are happening in our region. I'll use the Oakdale Commons as an example. They're also including childcare at their facilities so that for workforce, they call it workforce housing initiatives, that childcare is available to those folks who are working at that respective employer, but also to the community at large. So we're continuing to push for more supports for those developments, again, tying it to childcare, tied to childcare. Reproductive care, this, as I said earlier, is a big priority of mine. Um, One of my bills that we were able to get passed in the Senate, will definitely push for it to get passed in the Assembly, and that's access to contraceptive care. My bill to establish contraceptive emergency contraceptive vending machines at college campuses, SUNY and CUNY. Like I said, that passed in the Senate. We're still pushing for it in the Assembly, but that's a significant investment through policy. But there's more. I mentioned the Reproductive Equity Fund. There's also, we passed the 12 bill package in the Senate this year that included maternal health and reproductive health bills. Uh, Another aspect that we have done with reproductive care is also looking at exposure to toxic chemicals in our menstrual hygiene products and expanding access to menstrual hygiene resources as another example. I already mentioned, maybe I didn't mention here, but I'll bring it up, the Equal Rights Amendment. That's another big way we're trying to expand access to reproductive care. One of the first votes that I took in the Senate as a freshman senator, as a member of our all women class of senators, first ever in the history of New York, was advancing the Equal Rights Amendment. That to me is one of our largest investments through policy as it pertains to reproductive care. Because we know, unfortunately, that reproductive rights are often subjected to political wins and whims. This is a way to provide further protections through our state constitution. So that's what the Equal Rights Amendment uh, encompasses, along with protections against discrimination. Some other key areas I would say with reproductive care, and I would be remiss if I didn't bring this up, most certainly in light of the Supreme Court decision, not Roe v. Wade, but specifically as it pertains to as it pertains to uh, abortion medication. So the battle that happened in the Supreme Court that's still ongoing in New York, we took steps to provide more supports for that resource as well. This is a measure that has been on the books, tested, and is safe through FDA. And so trying to ensure that those resources and others, and including providers, trying to ensure that we have access to more providers is also important. So those are just some of the ways. I know there's a lot more, but you didn't ask for a whole lot of detail, but those are just some of the high points for sure.
Thank you. I just
Mhm.
want to wrap up by asking if there's anything else that you would like to share to help students decide who deserves their vote.
Yes, I one, as a former educator at Binghamton and just overall just observing kind of where we're at in this moment in time, one of the things that uh I know that we all collectively hear when it comes to elections is that you need to vote. And my response is absolutely you need to. One, because if your vote wasn't powerful, there wouldn't be so many measures to take it away from you. So there's that. But also, uh, we know that our democracy only works when we participate in it. And so not only does our democracy work when we participate in it, that means that requires us to lift up and anchor ourselves in those values that make us all human: dignity, respect, justice, fairness. And what often happens, and unfortunately often happens, is that we have leaders that become involved to be somebody rather than do something. And so, for me, as someone who's been doing something in our community and most certainly across the state, I want to encourage every single person that watches this to understand what's at stake, because it's not just simply in this election, what's at stake is our democracy. What I truly believe what's at stake is our humanity. We are literally fighting. When you talk about access to quality, affordable housing, healthcare, good education, those are fundamental needs that, quite frankly, we shouldn't have to fight for. Those should be automatic things. And unfortunately, because of the acrimony that exists in our communities overall, we are just moving further and further away from those things that connect us together. And so it is my call to action, if you will, that I really want to encourage everyone to not only get out and vote, but also continue to be involved in the community, be involved on campus. It is so important for us all to understand how these respective institutions that we are a part of and systems work so that we can change them for the better for everyone. And that's not just for this election cycle, that's for us moving collectively together as a community for years and generations to come. That is my hope, and that is what I am actively working for every single day.
All right, thank you so much, Senator Webb, for coming today and for your detailed responses to my questions. Students, please make sure to check out the other videos so you can see all the other candidates, and do not forget to vote on November 5th. If you have any questions, please come to the Center for Civic Engagement, which is located across from the Marketplace in the Union.